Welcome to Love and Guts again actually, this is your second time, isn't it, Dan?
It is. It is. I think it was 1 or 2 years ago we did our
I know.
initial.
Probably
Yeah,
even longer. It's
could have
crazy.
been. Mm.
Yeah. So, for those that aren't familiar with you, I'm going to pop that conversation we had in the show notes. So, please go and check that out. But I will read through your bio. I know everyone loves to sit through their bio.
Hope it's the short version, and
Yeah.
it's pretty long.
It is definitely the short version. And, guys, if I'm looking up there, I'm not being rude. Just kind of that's where my screen is. So, Dan Sipple. He's a naturopath, nutritionist, and herbalist with a Bachelor of Health Science and a registered member of ANTA. Shaped by his own journey from illness to recovery, Dan takes an individualized, multimodality approach that blends allopathic, functional, and complementary medicine. He has a special interest in gut health, hormones, autoimmunity, stealth infections, and healthy aging. How good is the word stealth? I just love it. Based on the south coast of New South Wales, Dan is also a passionate researcher, musician, gardener, and father of two. And we both mentioned we have our kids sort of teetering in the outskirts of our home. So if we get little people screaming in the background, we do apologize. We're just
Little
keeping it
knocks on the
raw and
wall.
real.
Yep. As parents,
And
we
we're
got to
just,
do it.
yeah, yeah. So let's get into the questions because obviously I've only got you
Yeah.
for a limited time and I am very conscious of that. We're going to dive into all things hormones, andropause, and their kind of relation to gut health and that sort of thing. So I'm
Let's
excited.
do it.
I feel
Let's
like I'm
dive in.
there at the moment. So can we discuss, like, during peri and andropause, we see that sort of fluctuating estrogen and testosterone. How do these shifts influence gut motility, permeability, and microbial diversity?
Yeah. Yep. That's a really good question. And I suppose when we
Actually,
think, yeah,
sorry to be rude and interrupt.
not
Some
at
people
all.
may not actually know what andropause is. Can you just give us a bit of a brief
Yeah. Yep. Good
explanation
one.
of that?
I feel like it's getting a little bit of traction now,
It
but it's
is.
still a bit foreign. Yeah. So it's obviously the male version of menopause. And I think I was only saying this to someone the other day that it's much more long-winded, which I think is why perhaps it's a bit slower to catch on. Whereas
Yes,
menopause, I mean, we have the perimenopause, which is getting more traction in medical circles, which is good. But
which
the
is long-winded.
andropause, yeah, true. But yeah, it's less sudden. So you could pretty much argue after a man's testosterone sort of peaks out in his 20s, it's pretty much on from there. So we can start to see andropause theoretically as early as the 30s, which sounds pretty scary. But typically, more often than not, we're seeing it more around the 50s and 60s. And often men, as we are, we're pretty lazy. We sort of don't do anything until the last minute. And often,
Yeah,
we'll get to those really, really pronounced cases where men want to do something about it, and 50% of the time it's probably not even the man initiating it. It's just
yeah.
it's the other half. But yeah, it's usually by then that a man will go in, and get a hormone panel done through a doctor, and it's like, yeah, the hormones by that time are really bottomed out, and it's post andropause typically most of the time. But
Yeah.
we'll get into all of that fun stuff today.
Yes. So can
Mm.
we discuss how those shifts influence gut motility,
Yeah.
permeability, and microbial diversity?
Yes, and it's just literally that, Lynda. So it's kind of like, the whole landscape between hormonal health over to gut health is probably less talked about, which is why I'm excited to jump on here today to shed some light on it. But we can kind of just say that for both genders, it's the same deal. So like we're seeing decreased motility
Mm.
with the decline of estrogen and testosterone. So estrogen, progesterone for a woman, obviously, and primarily testosterone for a man. But with that, yeah, as it pertains to the gut, it's kind of like motility is going to start slowing down. We're going to see an increase in intestinal permeability across the gut barrier and decreased microbial diversity. So, distilling that down, it kind of just means weaker digestion, poorer digestion, more chance of systemic inflammation. So that's kind of where it all heads. And when we look at it more in a long-winded way, it's kind of like how do hormones affect the gut architecture? It's multifaceted, of course, and we'll jump into the nooks and crannies. But overall, if I had to say how it's increasing the chances for systemic inflammation as men and women head into those later decades. So they're going to feel that, they can feel that in the digestive area itself. But if we look at abroad, we're talking anything from, mood shifts to sleep shifts, obviously changes in metabolic and cardio profiles and all that type of stuff as well, way beyond the gut.
And can we discuss maybe the role of the estrobolome?
Yeah, sure. And this is interesting in doing the research for this. There's the androbolome as well, which was a term that I didn't know about. So there's another
That's
one.
a bit of a, wrap your teeth around that, wrap your tongue around androbolome, bolome.
Androbolome, yeah, estrobolome's hard enough as it is.
Exactly.
But yeah, this is kind of like the subset of microbial species in the gut for a woman and a man, respectively, that will help detoxify, break down hormones. So that's again another connection between the gut microbiome and the hormones that might seemingly be sort of disconnected. But the fact is, we do have these families with these sort of dedicated roles of overseeing how these hormones get broken down. And if that's done really poorly, and that can even happen, in earlier decades, way before andropause or menopause, we can see estrogen reabsorption and enterohepatic recycling, and therefore the risk of more estrogen dominant conditions increases. And then similarly for a man, if that's overseen poorly by the microbiome, the detoxification of testosterone and DHT and these more male hormones, we can see flow and inflammatory effects in that regard as well. So again, it's just kind of highlighting the microbial composition and how important that is for good hormone health, because it's not often that we think about, especially men. Often in my consultations with men, I have to explain these things about how if you want good hormone health, which 90% of my male patients come to me for, it's like we've got to go deep with the microbiome as well, because we could be potentially overseeing a lot of hidden gems there, and obviously same for females.
I love it. And you've mentioned also that sort of shift in the mood or the impact that this has on the mood, peri and andropause, and sleep issues. Can we discuss that a little bit more? So what's the microbiome's role in modulating neurotransmitters, and how can this influence those symptoms?
Yeah, yep, totally. So again, it's kind of like if we think about the different roles of the microbiome above and beyond digestion and inflammation, we do have certain bacterial families again that will help synthesize cofactors for different neurotransmitters and also synthesize neurotransmitters themselves. So serotonin, for example, a lot of people know, there's that quote, 90% is made in the gut. If we're connecting it to sleep, then we can sort of argue that we've got poor serotonin synthesis via the microbiome. That's going to impact melatonin synthesis. Obviously, serotonin there, converts to melatonin. So we could argue that that person is going to potentially suffer from sleep disturbance as well as mood issues. And serotonin being, very pro motility, which I'm sure your audience will be very all over. That's obviously a big one we look out for too. Just as much attention, I think, should be given to dopamine and different catecholamines. And this is where it's really interesting. Like some people's microbiomes, we're starting to learn, can rig them for a more heightened nervous system activity and profile. And that's via, if their microbiome is shifted towards a certain composition, they might be churning out way more dopamine and different catecholamines and, making them very adrenalized. Just in the microbiome, let alone environment and lifestyle and genetics and all of those other sort of different compartments. So yeah, that again just sort of highlights how microbial health is super, super critical for brain health. And that gut brain connection is definitely getting more attention. And a lot of people are, and companies, there's so much more products about, gut brain on the market these days. If you do a scroll on Instagram, nearly every second product I feel like says gut brain, which is good. But yeah, it does definitely come down to the composition of the biome.
So beyond that estrogen and testosterone picture, that kind of happens during these times, how do the adrenal hormones like cortisol impact the microbial balance and the inflammatory state during that life stage?
Yeah, I love that conversation because it's something that, a lot of people will ask about cortisol and know what it is and recognize it as the stress hormone, but we don't tend to think about how it impacts the gut so much. We think of it very, very adrenal specific because it's obviously made in the adrenals. But the way I like to think of it is that the higher someone's cortisol, especially at a chronic level, we can straight away, understand that yes, there's going to be adrenal issues and stress and whatnot, blah, 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 blah. But cortisol is very catabolic. So for a man in particular, if he's looking to optimize his anabolic hormones and prime his testosterone, that conversation, and women too, of course, we're always interested in where cortisol is sitting. But from an actual gut zoomed in perspective, it causes that sort of tight junction disassembly. Chronic high exposure to cortisol will break that down. So not only do we think about it breaking down muscle architecture, but it's also the architecture of the gut. And as I was saying at the start, that over time will just increase more systemic inflammation via the gut. And then it's like, guess what? The adrenals just have to ramp up even more cortisol to continue to put out the fire. Yeah.
Mm.
So it's a really delicate balance, that one. And I don't think we should ever look at, hormone profiles for men or women without considering cortisol.
Yeah, absolutely not.
Mm.
And it's so multifaceted, isn't it? It's, then obviously you're looking at sleep and you're looking at, their stress levels and how they're managing those sorts of things to that have a part to play in how you respond to
Mm.
estrogen, testosterone, cortisol, all that sort of stuff.
Well, that's the other thing too. A lot of people will go on HRT, and if all of this stuff isn't in check, Linda, as you know, you would have seen it too, those hormones just don't land. And it
Mm.
can often make them feel worse. And these are typically the people that say, I tried estrogen, or I tried, testosterone cream or injections or whatever it was. And they might not stay on it. And it's like, did you do all the work under the hood?
Yeah.
Probably not. And if you did, that might have landed a lot cleaner for you, and you might have been able to soak up those benefits a lot sooner. That said, HRT is a entirely different conversation, but from what I understand with patients, and I'm sure we'll talk about it, it's something that you obviously want to do through a doctor and have it monitored, but not something that you can expect to turn everything around immediately. It's like a good 6 to 12 months, for men and women to really understand what level do they need individually,
Mm.
and is their system able to keep up with that and the breakdown of it. And that's why we love testing, because we can check all that out.
And we definitely want to get into the testing side of things. But since you brought HRT up, can we talk about that, bioidentical hormones and conventional therapy like HRT? What do you see in the microbiome diversity and function? Like, what's the sort of, do you see any changes or patterns or anything from people that potentially could be taking these things?
I remember I had one patient, springs to mind straight away, that nothing else changed apart from the fact that she did do HRT. And we happened to have a co-biome test. I'm not sure if I'm allowed to mention brands, but
You
I did.
can, absolutely, because I'm a big fan.
Good. Okay. We had a co-biome before she started seeing me. That was semi-recent. And then we did a fresh one straight off the bat. And the only thing she had changed, because I said, don't change anything. I won't put you on any supplements until after we see the results, as we often do. And the diversity had dramatically increased. And the only thing
Yes.
I could put that down to was the HRT.
Yes.
And that makes sense with the clinical literature, because it's kind of offsetting the effects that the perimenopause, or menopause in that case, was having, and ramping it back up to almost a pre-menopause state.
Mm. So it can be useful
Can be
for
useful
some.
for
Yeah, yeah.
restoring the gut kind of indirectly. Yeah.
Yes. Yeah. And what I really want to talk about, well, I'm fascinated to hear about as well, is your experience with, the link between sex hormone levels, bile acid metabolism, and fat digestion, sort of why this matters for microbiome health in midlife.
Yeah. So again, kind of like we were touching on the start, with the motility backing off, with andropause and menopause, we do see the backing off of primary bile acids and secondary bile acids. And this area is really fascinating. I find it super interesting because there's not a whole lot sort of published about it. But you speak to the Jason Horrocks and these sorts of people, and they will just jam out on how important it is. So it's like primary bile acids get made in the liver as kind of like the first line, and secondary bile acids get made in the microbiome. But why that matters is because we're super interested in the digestion profile. So, digesting fats in particular. Why is that important for hormones? Well, because fat's the basic molecule, for every steroid hormone in the body. And so, without it, with that motility backing off and menopause and andropause setting in, we might see things like bloating, greasy stools, gallbladder issues, stones, and deficiencies in fat soluble nutrients, which, as I just described, is critical for hormones. So getting into that territory with bile acids, making sure that microbiome isn't secreting pro-inflammatory bile acids is really important. And so, like when we look up IBSD, take for example, in the literature, and we work out, what are the common instigators for that kind of gut profile, often it is like these bile acids from the microbiome that are being churned out are just super, super pro-inflammatory and just irritating the colonocytes and creating a lot of subclinical inflammation and maldigestion, basically. So, yeah, it's kind of like, again, returning the the serum levels of these hormones to a pre-menopausal or pre-andropause state, we get that sort of added on benefit of ramping up bile acid production again. And therefore we get better digestion, and downstream we get a better microbial composition.
So you mentioned a few signs there, clinically, that we might see diagnostically, but also that someone might experience if they notice that shift with bile acid. I'm not really wording that correctly. So how might someone notice that they've got that shift in bile acids in their daily life? So you mentioned, fatty stools as being one of those symptoms.
Sure.
What else could alert someone that that's going on for them there?
Yeah, I think nausea as well. Anytime there's a fatty meal and nausea kicks in afterwards. People with a history of refractory SIBO, where they might deal with the SIBO, but it just keeps coming back. That again is like another classic case of where, okay, we can't just look at this person's gut. We have to consider the other networks. We have to look at hormones and see where that's at. That might offer the clue for this person to kind of really turn the corner. But in terms of symptoms, it'd be greasy stools, nausea, bloating after meals, history of SIBO, fullness. And typically with those cases, I'm seeing as well on their bloods, we're just seeing deficiencies for no other given cause, where there's no dietary restriction or medication that might be causing interference. So, vitamins A and D, I'm big on testing.
Yeah. And since we're talking about tests, can we discuss, your gut and hormone tests that you typically do, that you find of value? And would you be doing them all at the one time, generally in a perfect world, or would you kind of specifically be drawn to doing one before the other? Say, for example, your shotgun metagenomics microbiome test prior to, your workups, your other workups. What are you typically using?
Yeah, it's a good question. It's funny because nearly every person that comes through the door gets a co-biometa explore.
Yeah, likewise.
But yeah, I suppose it depends on, Lynda, what they are presenting for. So for instance, if I get a male athlete through the door and it's just all about, his diet's pretty good, there's no massive history of gut complaints, and it's just very hormone focused, I won't jump into a gut test. That will still come, but it'll probably be the second step. If there is obvious digestive symptoms and there's a history of that profile of like never well since the trip to Bali, or I felt like perimenopause kicked in really after I had that infection, or those antibiotics or whatever it was, that's where I'm interested probably in seeing them ideally at the same time right off the bat, just test for both. In a lot of cases though, in saying that, patients will come through the door with just serum markers, and there's a lot we can detect and just see from that. So often it's not a case of, unless we do dried urinary sampling like a Dutch test or an endomap or whatever, that all is lost. Because when there's that real frank deficiency, or really full on estrogen dominance and progesterone deficiency, that is easily detectable, I think, with just a good blood test at the right time in the cycle. And symptoms.
And you've mentioned, so like a good blood work that can be, you can determine a few things there. Do you tend to prefer that over the things like you mentioned, the Dutch testing? And there's a bit of controversy around some hormone testings out there. So I would love to hear what you would find really valuable. Is it the simple blood workup that you do at particular times for that?
I'm going to say for men, yes.
Yeah.
Men are a lot more simple, as we know. We're an on and off switch. Testosterone's either high or it's low. Obviously, there's some nuance in there too. With women, I probably do prefer an endomap or a Dutch test because of all the secondary metabolites and the phase 1 and phase 2. And, we get a glimpse in on what's their glutathione like and what's their methylation like. And, how us practitioners obviously love all that information, because it really clues us into things like we've been talking about. Are they recycling estrogen too much? Okay, what type of estrogen is it? Is it the protective type, or is it the more pro-inflammatory oxidative type? So yeah, for men, in summary, bloods are good. Sometimes we'll go to those secondary measures. For women, because it's a lot more sophisticated and there's that bigger kind of orchestra, that's where those other tests can offer more benefit, I think.
And when you do the serum hormone panel, what are you typically doing? Like your free testosterone, your estradiol, SHBG, DHEAS. Are you doing, what else are you doing?
Yeah, and thyroid, Lynda, always. So
absolutely.
Yes. Hormones are there. Sex hormones primarily for men and women. Adrenals, if we can get them. although that is probably, you'll agree, better captured, I think, on the Dutch test.
Which one are you talking about?
um, with cortisol and adrenal
So
hormones,
that's,
because
I was going to ask, what's your preferred cortisol measurement?
yeah, yep.
Yeah.
Cortisol is good if it's just a snapshot in the morning, but I usually like to see a couple if it's a blood test,
Yeah.
because it can change. If a person has a shitty sleep, well, I don't know if I can curse,
No,
but I
you
just did.
can. You can.
Then yeah, like, and that's been me before, where I can remember I did a cortisol test one morning, it come back in the 600 or 700s, and it was, well, what is going on? And then I remembered I was up all night wondering if that tree
Yeah.
next door is going to crash on my house. So that probably explains it.
That's a bit
But
alarming, Dan.
yeah,
Jesus Christ.
exactly. Yeah, a bit dramatic. And yeah, so with cortisol and DHEA, it's good to check those out on bloods. But I love that rhythm, especially with cortisol, where we see, is it high or low at 8 a.m.? What's it do by 12 p.m.? And we get
Yeah.
that sort of, whole 12-hour cycle. Does that answer the question?
It does. And I'm glad that you mentioned the thyroid
Yes.
panel as well, so the thyroid profile, because geez, that can change during that time, like your
Oh yeah.
menopause phase.
Yes.
So worth really doing the full gamut and testing the full
Yeah,
thyroid
big
panel.
time, because I mean, that's its whole own conversation. But if that's
Yeah.
where there's autoimmunity, for example, or there's
Yes.
just frank hypothyroidism, then it's kind of like we need to park the peri conversation and tend to
Yes.
that, because that obviously will cause delays in all of the stuff we're talking about just in of itself.
Yeah.
Delayed motility and absorption. It is being talked about more. Rachel Arthur did an awesome job recently on a podcast just talking about like thyroid receptors all through the gut. We forget that and how important that is. It's not just up in the thyroid and the liver as well. So yeah, thyroid, reverse T3, all the steroid hormones, cholesterol profile, vitamin D, vitamin A, I think super important in that conversation.
You're looking at your blood glucose type things as well.
Yes, thank you for a reminder. Yeah, so definitely that sort of cardiometabolic profile, methylation, MTHFR, and yeah, I'm sure there's one or two I've missed, but yeah.
Yeah. And so obviously the shotgun metagenomics and looking at those parameters too.
Yes.
When it comes to, so midlife is where I'm at. Obviously, nearly 50. Jesus Christ, I'm 47 this year. How did
You're
that
doing pretty well,
happen? But I have to say, before I jumped on, before we actually started recording, I did say, interestingly, things are starting to occur. But it's such an interesting time because 47 years old, have like young babies, and so having later children, you kind of still breastfeeding, so you're not bleeding. You're wondering if you're okay. Have we stepped into are we going straight into menopause, or where are we at with all that stuff? And then your skin starts to shit itself, and you're like, is it perimenopause? Is it thyroid? What is going on?
That's where being in
Leaks
naturopath's a bit of a curse, right?
Like,
we're like, is it this? Is it that? What could it be?
Well, and interestingly, like talking to you, it's like, you've really stop guessing and start doing those testings, and even for yourself, because life is busy as a parent, and you kind of put that on the back burner and you try different things, and you're like, right, now I'm really just throwing things at the wall and I really need to investigate a bit further. But yeah, I don't know how that came up for me, but yeah, as I was mentioning, midlife, it's often a turning point for inflammatory and autoimmune conditions. How does that intersection of declining sex hormones and gut dysbiosis contribute to that risk?
Yeah, I love that, because that's a big part of my clinical focus with inflammation and autoimmune conditions. But we got to remember, sex hormones are anti-inflammatory primarily. Yes, they're awesome for helping us feel good, drive libido, mood, all of those things, but they do modulate inflammation. They, stimulate Treg cells, for example. So super, super autoimmune protective. So we can kind of see how with these life transitions, which are natural, we can see why there's such an increase around that 40s to 60s age bracket of autoimmune diagnoses. And it could be grumbling away for decades before that. But, once those hormones really drop out, it's almost like all is revealed. So then one could argue, well, if you've got a family history of autoimmunity, do you kind of circumvent that? And if you have the knowledge and the means and the funds and all of those things, do you circumvent that by jumping on HRT? And that, I don't know the answer to that, but it makes sense theoretically. I think and I'm sure again you'll agree with me, there's cases where you can kind of see things happening and you can intervene with botanicals and kind of steer the ship again and get some balance back. But I always say to men and women, there's going to be a time in which the herbals may not work for you anymore.
Yeah.
And just be real, just own it and be really upfront about them, because it's kind of like once the hormones fully decline, the herbs can't help recycle what's not there. So at that stage, do you just give way to that and accept? Or do you intervene with something like bioidenticals? And that's obviously a personal preference. But I'm certainly not opposed to my patients using HRT done right with the right doctor.
Because you've got a personal history with autoimmunity, which you've spoken about previously.
Yeah.
How are you managing, moving into this sort of phase, which may happen in 20 years? I don't know how old you are, but like, how are you kind of preparing yourself for it?
Yes. Yep. Well, I'm 39 in January, and strength training is a big one.
Yeah, absolutely.
Yep. So that's got to be a non-negotiable. And I love that naturopaths are just saying that now. It's like, no, this is non-negotiable, because it's such a part of being healthy that the old school naturopathic training, we didn't get any training on how important muscle mass is.
Yeah.
But it's very much weaved into, modern healthy living, and a lot of naturopaths talk about it, and integrative doctors, and it's so, so true. So that is kind of like your health insurance, I feel like, going into your 40s and your 50s.
Can you discuss that a little bit more? Why is muscle training so important?
Sure.
Strength training.
So if I had to sum it up, and I do use this all the time, I say that mechanical distress on your skeleton signals your body to produce more hormones. So yes, they might be declining, but if you put that mechanical distress on your system at the right length and interval and timing and whatnot, you will help amplify the amount that your body will output in terms of those protective hormones, and you will delay the onset of the inevitable andropause and menopause. So that's really that health insurance. So strength training is a big one. Obviously, diet is huge. Yeah. And in this conversation, it's interesting because I kind of feel like there's two camps. We've got the gut protective camp that's all about plants and fibers, which I get and I love. And then, a lot of the pro-metabolic camp, which is all about protein and fat.
Yes.
Isn't it?
Talk to us about your thoughts.
Yeah. And they don't always agree, these two camps, but it's boring, but it is just that. You just need to have a good appreciation and understanding of both and blend them.
Yeah.
Yeah, because a lot of people are just on one extreme or the other, and not so much doing the dance in the middle. So the diet, sleep is huge as well. It's like hormones get manufactured while we sleep. And I feel now, heading into my 40s, that is the single biggest determinant of whether my health's on or off is sleep.
How do you prioritize it with kids? Please tell me. Is it just me that's
tranquilize them?
Yeah. Well, I just think it's more of I'm just having a tantrum at this is the only time that no one needs me at that point, first part of the night.
Yes.
No one's sucking on my boob. No one's needing me to cook anything. And so I'm just going to look at rubbish on my phone, or I'm going to get up and and have blue light, like work or something. And it's just like it's like this protective. This is just for me as a parent, where I don't need to be needed by anyone, or no one needs me. So how do you break that cue and prioritize your health? The health practitioner is asking that.
Well, I'm not going to lie. I do it. We all do it. Let's just be honest.
Yeah.
It's the dopamine hit. It's the our time. It's the recharge. And, I think it's just, you got to be sensible with, and it might sound super geeky, I don't care, but you throw your blue light blockers on, you get the red lights, and you start dialing the kids down with light early. That's what
we do. We have the red light lamps everywhere.
Got the red light disco.
There's no lights on it after dinner, that's for sure.
Yeah, nice. So it's little tricks like that.
Huge. That just makes you alert when you have a proper light on in the evening.
It's massive. It's massive. I often say to folks, if you can afford to, change all your light globes to do the, like yellow in the day and red at night if you can. Your house might look a little bit weird from the outside to your neighbors.
It actually is great because we've always got those rock lamps on. People always think that someone's home. Like it's fantastic. Right. It deters people, I think.
Yeah. Good one. Yep.
Yeah.
And
so
then
sleep.
Obviously, so sleep, and then just doing the things that like we should do to ourselves to have a good sleep with our kids. So I don't mind saying this on online or whatever it is, but like I give my kids CBD oil.
Yep. Amazing.
Don't mind doing that. Yep. I'll give them obviously like different botanicals, your passion flowers, your St. John's wort, all of those are helpful. What I find though works good is just to
Are we
rotate them.
talking as needed,
Yeah,
or
not
like you're
like
doing that every day at a
not kind of
particular
like
dose?
it's 8 o'clock, get down because here's your dose of CBD. Yeah, no,
Yeah,
it's more as needed because there'll
yeah,
be nights where it all just falls into place. It's rare, but it happens, and you don't
yeah,
need to. But as you know, with kids, like there might be the cold that comes through every winter or whatever, and it just every little while that something comes in and just rocks the boat a bit, and you've got to kind of
absolutely.
reestablish. Yeah. So sleep is huge. What do we say? So strength training, the diet, the sleep.
And the diet, just to confirm, you were saying it's not
Mm,
so black and white.
it's not so black and white.
It's it's just very nuanced. I think it's best to be working with a practitioner at that point.
It is. And
But
it's the, like, a lot of people will hear this and have heard of it, but the 30, 40 plant species a week thing,
yes,
I struggle with that sometimes.
yeah,
It's hard, but you got to constantly remind yourself of just have a basic understanding of why we're doing it. Okay, we're doing it so we keep diversity scores up. Why do we want that? Because it protects our microbiome and protects
mm,
against inflammation. But at the same time, I'm also a big fan of getting enough protein and enough good fats
yeah.
for muscle maintenance and metabolic health. So I think we've got to strike that blend between both those worlds. Um,
With the training as well, you mentioned to delay
mm,
onset, but
yes.
also doesn't mean that when you've hit that point that you don't need it or it wouldn't be useful
Mm,
strength training.
no, you still absolutely need it. I think we're just
Yeah.
thinking about like building your bone matrix, for example, and just
Yes.
like having protection against when it happens. It's going to happen.
Yep.
Whether you intervene, obviously, or not, is personal.
But
But
I'm
you
also
just
thinking like blood glucose and
yes,
things flapping in the wind, like your elasticity changes, and so I think
totally.
that as much as I love to do yoga and Pilates and all the rest of it, like there's no there's no comparison in my mind when I do strength training of what happens to my body versus the yoga and the
Mm.
Pilates,
What do you
unfortunately.
notice just while we're there?
Well, I mean, I honestly have to say, over the last year or so, heading into my being 47 in October, my elasticity has really dropped. Like it's not, it feels like I've accelerated aging in the last year. But also, older parent, sleep is poor,
Sure.
uni studies, like it just, I don't know if it's just a compounded lots of things driving it.
Mm.
But
Yep.
I do notice when I do strength training, like my tone, less things are flapping in the wind. Like I feel stronger, of
Yeah.
course. Um, yeah, I aesthetically, I do notice a big difference.
Yeah. Great.
Having said that, if I can only kind of get into Pilates or something at home, I will make sure that you do body weight type of
Yes.
resistance, but it's just not the same in my mind when I do. It's
Yeah.
just not the same as if I do a CrossFit class, for example, and I'm you know, pumping some weights.
Well, it's
So,
refreshing to hear that because and it's no discredit to them, but a lot of patients will say, "Well, I do Pilates. I
yeah,
kind of don't need to strength train." I'm like, it's technically two different things, and I think you'll
they
feel the
are.
difference if you do.
Yeah, I mean,
Um,
don't get me wrong, Pilates is hard.
oh,
It can be.
totally.
You really, yeah,
Yeah, it is, and I only done the one session, right?
yeah,
But I can appreciate it. But I think like when you do that strength training, you're dumping a lot of catecholamines too, so that feeds back into the sleep. You'll have a better sleep, I think, if you do a really big weight session as opposed to, a big cardio session.
yeah,
Yeah.
yeah. So diet, strength training. What else did we discuss? What else would you be recommending? What are your top evidence-based dietary lifestyle interventions? We've spoken about diet, but other lifestyle interventions to support both hormonal balance and microbial diversity. You said 30 plus different plant
Mm,
foods, which is awesome for diversity,
yeah.
supporting the
Well, we haven't
microbiome.
mentioned stress yet. We did touch on
Oh, it's
cortisol,
huge.
but it's everything really, isn't it? I mean, when one of the primary symptoms of like waning hormones is just you're just going to feel more shitty and more irritable, and
Yeah.
your cortisol and your adrenaline's going to try and take over. The adrenals are like, okay, so the ovaries are backing off, the testes are backing off. We got to take over and
Yeah.
make more cortisol and more adrenaline, and that's grumpy old man syndrome 101.
Yeah.
So if you know about that prior to that happening and you've already got good like stress balancing protocols in check, you will do so much better in menopause or andropause. If you try and get interested in all of that stuff after the fact, I've seen that just go south. It just doesn't land really well. So yeah, and again, this might sound super rudimentary, but deep breathing, cold water therapy, social stuff,
Social's
making
huge.
sure, yeah, it's massive. Yeah. Making sure, okay, I'm a man, I'm 55, my testosterone drops, I feel really rubbish. I'm not going to let that affect my social life, because it can make you feel like you just don't want to socialize, like we
Yeah.
touched on before. All of this affects neurotransmitters too, and testosterone in a man is going to ride alongside dopamine. And I say that to a lot of my patients that are blokes. It's like, when your T drops, your dopamine will drop too. And again, if you drive your dopamine up, your testosterone will follow. So like that drive and that motivation will return.
Yeah.
And that's really clear to see when that's happening in some patients, because they'll be like, I used to do this stuff. I used to do A, B, and C, and I just don't care now. It's like that.
Yeah.
I just can't think of even having the desire to do it. And it's like, oh yes, your dopamine is in the pits.
Yeah. And
Yeah.
it's, look, you really got to find something that resonates with someone though, especially when they're in
Yep.
the pits, because we're not saying
Mm-hmm.
don't do it, because you're probably, it's going to be harder now. It's like, well, like you said, cold therapy, maybe deep breathing for some,
Yeah.
diaphragmatic breathing. The social thing I think is really huge. I think
Mm.
if you're feeling like you want to hermitize, or you're feeling a little bit lonely and you don't have the want to go out, where you could potentially start is to think about what you're interested in doing and just join communities. Like, there's so many different types of communities out there. There's knitting, there's, whatever it might
Yeah.
be, playing cards, bocce. Like, there's just so many different types that you could enter into as an individual, and then just have this interaction on a
Yeah.
regular basis.
That's so important, Linda. Like, it's not equally. I mean, it's equally important. It's not important more for one gender or the other. But I will say this: when I see a male patient engage that way with another men's group, like down here in the South Coast, for example, we're lucky enough that there are holistic-minded men's groups, and you talk to men that before and after attending, and you just think, wow, that was the medicine for you.
Totally.
Just be able to get in
Absolutely.
front of a few blokes that are going through the same thing you're going through.
Yep.
Whether they talk about it or not isn't important. It's just
Absolutely.
familiarizing with what they used to do, having that camaraderie.
Yep.
Yeah, there's a lot of medicine in that. Yeah, so that's super important, and for women too, of course,
Oh, and I'm
respectively.
even thinking postpartum for women, because it can be
Yep.
so you're in the trenches. And even if you have those meetups, they can be very chaotic, and you may not finish a sentence. A conversation might be going on for 5 years, but it's just getting out and being exposed to others that are like, oh, I get it. I get what's going on for you
It's
right now.
normal. Yeah,
Yeah.
yeah.
And you just feel like you're not just, life isn't becoming too narrow, So I think that
Mm.
social aspect is just super important. What do you like to do when it comes to supporting your stress levels? Just
Music's big
asking
for
for a
me.
friend.
Yeah, yeah. I think you
I
got to.
probably need to work on this a little bit more too.
I think we all do.
Yeah.
Yeah, music's been my go-to, and there was a long time where, actually, when I had my first boy and got my degree and went into clinical practice, there's a long time where I didn't do it, and it was just all like, I'm this guy now, and it's like, we've got to make the money and got to build my
Yeah.
practice, and I had to do those things. But I really recognized that when I went back to incorporating music back into my life, how much that balance returned.
Yeah.
And it's still a balance that I have to juggle, because they are two different worlds sometimes. And
Yeah.
sometimes it's kind of like the naturopath gets too regimented, and then it's sometimes like the musician gets too relaxed, and you got
Yeah.
to blend it and be sensible and whatnot. But yeah, that's I'm lucky where that is my therapy, and that's what my brain really benefits from. Relatives of mine, it's getting in the gym, and
Yeah.
just if they don't do that, then the mental health shuts down, the sleep is off, the mood's different. And yeah, you've just really got to find your jam. And like you said earlier, it can be knitting,
It
something
could,
so
yeah, it could be
simple.
absolutely. Absolutely. It
Mm,
could be anything. Just carving out that time for yourself,
yes.
and exposing yourself to others. Social networks huge.
Mm,
Um, and what do you play an instrument? Is it
I
the
do play
guitar?
guitar.
Or
Yep.
okay. Yeah,
Yep.
I do remember. It's coming back to me now. Um,
Yeah.
so if you were to give practitioners one underappreciated clinical tip for optimizing both hormones and gut health in midlife patients, what would it be? And that's so hard. I mean, it's case
It
by
is.
case, isn't it?
It is. But if
What
there's
are a
one,
few things that you find yourself regularly recommending?
I think for the clinicians, if we're thinking along those lines, something that's very, good bang for buck and covers both genders and goes a long way, like with menopause and andropause, it's like choleretics, cholagogues, bitters. It's that bile support. It's
Yeah, okay.
so overlooked with hormones. Well, it's not overlooked. I shouldn't say that. A
Yeah.
lot of clinicians know about this, but instead of sometimes reaching for the herb for a male or a female that ramps up the hormone,
Yep.
get the bile happening in the motility, free all that up, and
Yes.
get them recycling better, and the microbiome is going to be happier, and the inflammation profile is going to improve. And from that microbiome, like we were saying earlier, insulin signaling and cardiometabolic profile suddenly looks better,
Yeah.
so that's probably the one that comes to mind. That is, yeah, just the one single intervention that goes far and wide, because we touched on other things like strength training and diet and stuff already. But there's so many, Lynda. That's a hard
There
one.
is. It is. I know it's a silly question. All right, let me just scrap that. No,
No, that's good.
but what are your favorite choleretics and cholagogues? What are you
You know
commonly?
what I'm loving at the moment is liposomal phosphatidylcholine,
Amazing.
which is a long one, right? But
Yeah. Yeah.
yeah, I'm really liking the results that I get for that, and
Yeah.
got to sort of jump a few leaps to get it, get that actual form of it.
Yeah.
But yeah, when we do and it lands and it's at the right dose, it sort of really tends to. I always say it's like giving your car an engine oil clean out. You're upgrading your engine oil when you do
Yeah.
that. They're like, oh yeah, that feels right. I think I need that. Who
Yeah.
wouldn't? And so yeah, that'd be my recommendation.
Great.
Mm.
And so, is there anything else you'd like to mention in this space that maybe we haven't addressed?
Well, I suppose we could go on forever, but there's some really, that I love peptides, and there's some
I
new.
do know that you love peptides.
Yeah,
Yes.
there's a new couple in that sort of space, and that space is always evolving. And there's stuff that I hear about that's not even available yet, but is coming up in research circles and stuff, which is really promising. So I can't recall the exact name of the compound, but there's one being looked at the moment that may even replace testosterone replacement therapy.
All right.
That works on endogenous levels and just keeping everything going from the pituitary down to the gonads.
Yep. Yep.
So yeah, novel peptides. Watch that space, and it's
And
always
for
a
those,
bit.
I mean, we spoke about that in the last
We
podcast a
did,
few years back. Do you want to
yes.
give people a brief description of what a peptide
Yeah,
is?
yeah. So all they are is just these little factories of proteins and amino acids strung together. Some are as small as 2 or 3 amino acids, and then there's up to like 50 and beyond and stuff like that. But most of them are body identical, meaning the human body can produce them on their own, and then they're just synthesized, exogenously and given that way. So the body can recognize them. And then there's others that, look a little bit different, but work in arguably safer ways than a lot of other therapies. And yeah, it's tricky at the moment because in different countries, there's different regulations around them. Getting your hands on them is tricky.
What's
But
Australia like?
yeah, somewhere in the middle. There is am I allowed to mention companies and brands?
Yeah.
Did we say? Yeah. So
Well, I'm
shout out.
hoping so. I've been doing
Yeah,
that for
right.
years. I'm like,
No
I've
one's
never
like,
been pulled up on anything since 2018.
oh, really? You got in trouble in 2018, did you?
What was that?
You got in trouble, did
No,
you?
I'm saying this podcast has been going since 2018 and no
I
one's
got
ever
you.
actually, I've been pulled up once, but that was more cancer
Really?
related.
Okay.
So
All
that
right.
was
So,
more wording around the person I interviewed and stuff like that. So I kind of got not wrapped on the knuckles, but had to sort of refine the way that it was delivered and change a
okay.
few things. So
But you're low on the list. We don't have to worry.
no,
You're not
no,
high on the
I'm
radar.
not a
No.
big offender of anything. So I'm
Okay.
good. So
Okay.
I'm not affiliated with any sort of brands or companies. So I'm assuming it's okay. I need to check
Yeah.
that.
Okay. Well, I'll say it anyway, and we'll see
Yeah.
how we go. But Level Up Health they were in Australia. They've now moved their production and everything overseas. I think they're operating now out of New Zealand and America. But really awesome company because it's all oral peptides. So there's a lot of peptides get given and administered in injectable form, which is super beneficial for a lot of them, especially like something like BPC 157 if you want to get that into a ligament or a bone or a joint or what have you. But when we're looking at this brand, a lot of actually all of their range is mostly liposomal and or oral.
Yeah.
So there's really good compounds and combinations for like neurological blends, and that's an area we didn't touch much on. But with menopause and andropause, the brain effect, the memory, the cognitive side of things,
Oh yeah.
huge, right?
Do you
We
want to
both
mention that a little bit? We'll
yeah,
finish off the peptide and go
sure.
into that.
Yeah, sure.
I've noticed it. So again, is it sleep debt postpartum or is it
It's got to be a bit.
perimenopause? Like you just don't.
Yeah. Yeah, it's got to be a bit of that thrown in there, Lynda,
Totally.
the old sleep deprivation. But yeah, so they do a blend called Neuro Regenerate, which is awesome. It's really, really new wave medicine. I always say peptides are like something between pharma and naturopathy,
Yeah.
So yeah, a lot of them are.
I look at lactulose as being that.
Yeah,
You know what I
lactulose
mean?
is in
It's
that
like
camp. Yep.
we use it. We don't have an issue with it, but it's
Yeah.
kind of not.
It's in a pharmacy. You're not going to get it on the dispensary shelf from a naturopath. But anyway, yeah. So he does that one. That's it's something that I think is probably 8 or 9 compounds, and there's herbals in there as well. Yep, jammed into the one product, and then there's a lot across the GI space. There's the razotide acetate, which is a tight junction modulator, and BPC 157, which is really good at just injury healing and wound healing. And that's one we produce in our stomach acid. So one that the body does recognize. But semi-recently, BPC 157 in particular did become a scheduled medicine. So now it's only available through a doctor. And even they've got to jump through some hoops. So that's why the landscape is a bit tricky with peptides. Sometimes they're available, and then you'll just see suddenly that sometimes they're not. And it's sort of one of those spaces that you've just got to monitor. But that is a really exciting space. I think we're going to see a lot happen in the next 5 or 10 years with peptides in the hormonal space specifically as well. Yeah.
Amazing. And was there anything else you wanted to say about the brain health aspect of the memory cognition?
Oh, just that it all goes to, no, I'm only joking.
Well, it's recalibration, isn't it? I think about Lara Brydon's book on this and how reframing that as being, well, it's not reframing, it's just what is. It's recalibrate our brain recalibrating at that time.
Yeah. And the whole thing is neuroplasticity, right? So it's kind of like, we know the brain is going to have a negative flow-on effect with the aging brain. It's kind of inevitable. But neuroinflammation is obviously huge. But I think if we can get, like I said earlier, if we're aware of this stuff prior to it all happens and is happening, and we can set up little lifestyle practices that, so for instance, in this conversation, building neuroplasticity and like stimulating BDNF and things like that, that could be crosswords, or that could be some type of game or some type of, activity that someone engages in daily, just to build that cognitive kind of reservoir. Again, you're still going to go through andropause, you're still going to go through menopause, but you're going to offset how severe it is.
Yeah.
That's kind of my take on it.
Are you still using a TENS machine?
I'm not using my TENS machine, but I'm using something very similar at the moment.
Right.
Yeah, it's a vagus nerve stimulator. You wear it on the neck.
What's it called, did you say?
Pulsetto.
Okay.
Yep. So it works similar to how the TENS does, but it's you wear it around your neck, and it kind of works through the the neck area. But you just reminded me, I've been pretty slack with it, so I'll have to pick it up.
After I had that conversation with you, I went and purchased one and was using it religiously for a while, me and the hubby, and then just
on the ears
fell off. Yeah.
And it's not super comfortable, right?
Well, it's not. And it's just a habit that you got to form again. And I think just with kids and that, it just gets all a bit tricky. You're kind of on a timeline of what to do next, and dinner and whatnot. And you're just taking time out for yourself to do the TENS. But it's,
can I give you a hot
forget
tip?
that I've actually got it, to be honest. So speaking to you, I'm like, the TENS machine.
Yeah, keep it in your clinic and do it when you're doing your treatments, like between patients. And
people are probably thinking, why the hell are we bringing a TENS machine up? Because people often use it for birth, but we're not using it for birth, right? We're using it for vagus nerve stimulation.
Yes.
So
yeah.
I'll attach the episode that we did a few years back on that. And we had not on that, but we spoke about that.
We featured it. Yeah.
If you want to delve in a little bit deeper. Oh my God, we managed to do a podcast episode without our kids interrupting. I can hear them in the background.
Yes, they're a couple of meters away, from the wall.
So where can we find you? What's next for you? What's happening in your world?
Yeah, I'm still doing my thing down here on the South Coast, working from home in the clinic, 9 to 5, Monday to Friday.
Nice clinic, by the way. You've got your
Thank
sauna
you.
in there, which is
Oh, you can see
fantastic.
that.
I can
Yeah,
see it. It's great.
you can see the edges of it. Yes.
And I actually thought that was the guitar stand on the other side, but it's a podcast. It's
You
a
know what, Linda? The guitars are all in this corner. You
Are
can't see
they?
them, but there's like a whole wall of them, and there's speakers everywhere. And I'm glad
Great.
that
You should
that's not
make
on
that
camera.
visible.
You reckon?
Well, I think it's just like having that sauna there. It's just
Mm.
you're practicing what you preach, you
Well,
know?
that's why the sauna's in the view, but the guitars aren't. People might start to
Yeah.
think, does he just do naturopathy, or is he kind of a bit of a weird hippie guy anyway?
No, I quite like that because I think it's an outlet. It's, having that other aspect of yourself, whether it's guitar or, drawing or whatever you
Mm.
like to do.
Well, that was
I
what I
think
was
it
doing
humanizes
prior
you to others,
to,
but also it's
yeah,
it's an outlet, isn't it? We're not
it's
just
a
our
massive
work.
outlet.
We live our
Yeah.
passion, which
Yep.
may be work, but it's just not, it's one aspect of us,
That's
right?
so true. It's
Yeah.
something I think about all the time. Like when people see you out and about, they know you as the naturopath,
Yeah.
So it's like, yeah, but that's one part of me. It's
Yeah.
not all of me.
Yep.
you know?
Absolutely. Which is nice when you
Yeah.
move to a new town, no one knows you.
Yeah.
And
Yeah.
then it's like they eventually find out what you
Mystique.
do, but it's nice to just
Yeah. Feel a
be
bit
that
normal.
blank canvas of this is me at the moment,
Yeah. Yeah.
without the job.
I should have asked you earlier, what's your outlet, Linda? Let the people know.
What's my outlet? Jesus, so actually, it's so hard to say at the moment. I feel like this year has been the hardest year for me. I've just
Mm.
been really in the trenches with the two kids. We chose not to send them to school early, and so I've been at home
Yeah.
with them.
Yeah.
And my daughter will go to school next year. So I feel like I've lost a lot of myself this year. I've
Mm.
even paused the podcast for a while. So I'm just starting to figure out who that is. Music's always been a big deal for me, but it's more
Oh, good
I
one.
haven't played an instrument.
Mhm.
More, I love, our household loves music. We play it all the
Epic.
time. Like
Yeah.
it's just, there's never a day that music isn't on. I love the ocean. But again, there's more to me than that. I just don't know.
Mm.
I'm trying.
Mm.
Next year, I will figure that out again. I've lost a
Yes.
lot of myself. I've loved being a mum, but I've kind of lost a lot of myself. So,
Yeah.
I'm excited to find out who that is again.
How old are the kids now?
My daughter's 5 and my son's nearly 2.
Okay.
So I've still
Okay.
got a little bit to go with him,
Yeah.
but I said and that's why I did uni. I still did, everyone thought I was crazy doing it while I had young kids, but I'm like, it's a piece of something for me. Yes, I'm getting up in the
Yes.
middle of the night doing the work, but I feel like I'm doing something for myself and I love learning and I,
Yeah.
challenging myself in that way.
Yeah.
So I did say to the hubby, next year, I'm all in work wise. Yes, we'll still have the kitty at home, but like, let's do something where I can actually be something other than what I've been doing at the moment.
Yeah.
Don't get me wrong. Stay-at-home mums are just amazing. It's just not for me to do that 100%
Yep.
all the time. I need other outlets.
Yeah. Yeah. And you just got to recognize that in yourself and
Totally.
and just do it. Yeah.
Yeah.
No, well
Also,
done.
this bloody climate at the moment, mate, a single income for for a family.
Right.
It's a lot.
We're all feeling it.
Yeah, it's crazy,
Yeah,
isn't it? So
it
that's
is.
just, I'm so grateful that we've been able to do it for so long.
Mm.
Because I say to my mum, how did you do it with 2 girls? Moving from Croatia to Australia, like how on earth did you guys she said, I didn't go to work until you were 5.
Yeah.
Your father just went to work. He came home and I had everything ready for him. The house was
Oh,
clean. His food was on the table. That was just our roles. And I'm
the
like, how
boomers.
simple is
The
that?
boomers, right? Don't know how good they had it.
Yes and no, because I kind of
Yes
go,
and no,
yeah, I
yeah.
like that to a degree, not having the stress, but also, not losing the identity is important
Sure.
to me. Like remembering who I am outside of being a mum.
Yeah, it doesn't work for everyone.
No, it doesn't.
Mm.
And that's okay. It's okay to own it.
Totally, of
I haven't
course.
failed as a mum. It's just
No, that's right.
So that was my long-winded answer to your question.
Yeah, yeah. Well, 5 and 2. Yeah, yeah. You're still a little bit in the trenches, but
Yeah.
Yep. You're not far out of it. Won't be long.
It'll be changing,
and then you miss it. You look back.
Well, that's what
oh,
everyone says,
damn.
right?
Yeah, you're like,
I miss
wish
the chaos and the noise and the someone
yet,
wanting me.
You know what happens?
24/7.
They'll go to bed, right? And then you and your husband will look on your phone and go back to old videos of when they were little. He's like, I don't even remember them like that.
Or they haven't called me in a month. What's going on?
Yeah.
How old are yours now? You've got what, 3?
8 and 5.
8 and 5.
Yeah. Yeah.
Yeah.
So we're just clinging on to the little one like he's a bit of a baby still, even though he isn't. It's like
Yeah.
that's our last little guy.
Yeah.
Yeah. Because it's cool, but it's a bit
Yeah.
sad. You're like, no,
It
they're
is a bit
only
sad.
little once, and now it's gone.
Yeah.
Yeah. The
It is
next
crazy.
phase is here.
Exactly. But
Managing
also,
testosterone.
I get excited by, what's my relationship with my husband going to be like again? We're going to date again.
Totally.
Like, this is,
Yeah. Yep.
we're going to be able to travel even more than we do now and on
Feels
our own.
weird. Yeah, it feels weird at first, to tell you what.
Yeah, does it?
Oh,
I
yeah,
mean,
that's what I'm
we
saying.
we go on date nights on the odd occasion, and we're like,
Yeah.
oh, so glad we still like each other, like
Yeah, we
interested
got
in
through.
each other. Yeah, because it's you're so ships in the night sometimes that you've really got to make an effort to have those touch points with each other and
Yes.
nurture your relationship.
Yeah, big time.
Yeah. So this feels like it's becoming a Joe Rogan 3 hour podcast.
Yeah, it does, but that's okay.
But it's nice to get to know you, get to know the person behind
Yeah,
the naturopath,
likewise.
slaughter and the guitar.
Yeah,
Yeah.
yeah. Well, I'm sure we'll do another one at some point.
Yeah, absolutely. So I'm going to obviously put all your details in the show notes.
Nice.
And so you guys go check it out, as well as a previous podcast episode that we did. And if you know someone that needs to hear what we've spoken about today, please send them this podcast episode so they can fill up on the valuable content that Dan has presented to us today. Thanks,
Thank you for
Dan.
having me. It's been awesome.
You're very welcome.